9 o'clock. Thank you for tuning in. One of the things that I do is I swallow my pride, and I sometimes will let you know things going on in my own life. Just to, if it'll help you. So Robin and I donate blood all the time, and usually when you donate blood, they tell you your blood pressure, and usually mine is really, really good. Okay, I'm always proud of that. Good blood pressure, good cholesterol, all the good stuff, right? Well, the other day when we donated blood, just this past Saturday, they said, your blood pressure is a little high. And I said, really? Dangerously high? No, but it's a little... And I said, you know what? You've never told me that before? So lately, I've been like the saltaholic. I don't know what happened to me. I just started doing salt all the time, right?
Oh, okay.
On everything. And I had a salt shaker right here. And I had one in the production room.
Yeah, I know.
I do. What? Oh, you've seen it? So I threw them away. I threw the salt shakers away. I know. That's right. Popcorn. So Dr. Benjamin Brown is on the phone. He is the assistant professor of neurosurgery at the Mayo Clinic in Jacksonville. And I threw away my salt so I don't have to see him. Teasing. He's going to talk about stroke. And that's one of the dangers of having high blood pressure. I hope I'm right about that. Maybe I'm wrong. But anyway, stroke is the 5th leading cause of death in the United States, and May is Stroke Awareness Month. Good morning, Dr. Benjamin Brown. This is an honor to have you on our show, by the way. Good morning, sir.
Good morning, Larry and Robin. Great to be with you both. Thank you.
You're welcome. I threw away my salt. What do you think? Is it improve my chances of living?
Good move, I think. I think the most important thing is that you did check in on your blood pressure and identify that there might be a problem. And certainly diet and lifestyle modifications, exercise, can go a long way to helping that blood pressure. So you don't need to be on medications, and you can reduce your risk of stroke in the future.
Yeah, and is high blood pressure one of the main causes of stroke?
It's one of the main risk factors for stroke. And just to go back a moment, stroke basically is a lack of oxygen to the brain that causes the brain to die. Those cells die and they're irreversibly gone. It can happen because an artery gets blocked in the brain and blood can't get to parts of the brain, or an artery can open and bleed. But high blood pressure is a risk for both of those, or either of those things happening. So certainly getting a handle on blood pressure will help with either type of those strokes.
Now, you mentioned exercise, and I have a question about that. If we hear that message and decide to go jogging tomorrow, are we being too anxious? Should we go get a checkup first to make sure it's okay to go jogging?
Very good point. And yes, it would be recommended that if you haven't seen your primary care doctor in the recent past, in the last half a year or so, that you should go get checked and make sure that your heart is in good condition for exercise. Ideally, you would want to get your heart rate up a little bit for about 30 minutes, several times a week, 4 or 5 times a week. But there are people that have severe heart issues that could be a risk. So it is a good idea to touch base if you haven't recently with your primary care doctor before starting on a new exercise program.
Well, we have learned that there were different kinds of strokes.
Yes, ma'am. Yeah, so the bleeding kind or the blocked blood vessel kind, and the treatments for those are very different, actually.
Are the symptoms the same?
Well, that's a great question. The one differentiator can be a sudden severe headache is more common in the bleeding type. But if you put that aside, the symptoms are basically based on which part of the brain is having the problem. And so the symptoms are very similar otherwise. And a good acronym for that's easy to remember is FAST, F-A-S-T. So weakness in the face or numbness in the face, arm weakness or numbness, speech changes, slurred speech, inability to understand what people are saying to you or can't get words out. And then T is time. No matter which type of stroke it is, the bleeding or blocked artery, getting to medical care as fast as possible will give you the best odds of a better recovery and more treatment options available to you if you get to the hospital quickly.
Are people from different cultures more susceptible to strokes?
There are some predispositions in different races, ethnicities, gender, age. But the important message, I think, is that stroke does affect everyone, even young people, certainly older people, and then both, all genders, all races. So I think the best message for today would be, if you identify fast any of those symptoms, that time is brain and get to the hospital as fast as possible.
The one thing you mentioned earlier that I want to go back to is the headache as one of the symptoms. If I take an aspirin and I have a headache caused by that, am I actually making the problem worse?
You may, yes. And so I think, right, aspirin is a blood thinner. If you have the bleeding type of stroke, it may potentially worsen things. So I think other than trying to treat yourself, it's more important to seek the medical care.
Is there a way is there a way for you, for a doctor, to be able to tell how at risk we are of a stroke? Like, can you see that the veins are weak or that a blood clot might form?
Right. So there are risk factors. So when you see your primary care doctor, or if you see a neurologist routinely, they will check sort of the dashboard, which is your weight, your cholesterol, your blood pressure, your blood sugar, and your lifestyle, and kind of look at all of those as a baseline. And if any of those are high, plus your family history, if you're at risk from a number of those dashboard parameters, they may order other tests to look at your heart to see if it's beating effectively. If you have an arrhythmia in your heart, that can be a risk factor. Or they may look at your carotid arteries in your neck, or listen to the carotid arteries with a stethoscope. That's sort of the second level of investigation. If you appear to be at high risk from either symptoms you've had or those parameters, they may order sort of the second layer of tests. And if you have something like an abnormal heartbeat or a clogged carotid artery, there may be surgical options to reduce your risk of stroke before you have one.
To the untrained eye, can a person misdiagnose a stroke as a heart attack?
You can, but heart injury is not my area of expertise, but you wouldn't typically have those. It's more of a pain syndrome and sweating and sort of those left arm kind of pain, but certainly they both come on suddenly, and they're related. They're due to dysfunction in arteries in our body, so they have some overlap, but usually they're fairly distinguishable for a medical practitioner between the two.
Dr. Benjamin Brown, thank you.
Both are very...
Go ahead, I'm sorry.
I was going to say both are very time sensitive. So if you suspect either one of those, again, number one thing, seek medical care.
Thank you for that message, and thank you for being on the air with us. I want to make sure that our listeners can get more information if they are interested. Is there a website that you can recommend?
Yes, sir. Our website is mayoclinic.org. It has information about these disease processes, treatments, as well as ways to get in touch with a physician.
Okay. And can I slip in one quick question? Does stress contribute to the likelihood of having a stroke?
Yeah, so that's been looked at. Stress is a little bit of a nebulous kind of term, and what does it mean? But I think there is association between that and blood pressure, and I think that's sort of the more concrete number you can look at. Mm-hmm. But if stress is causing a prolonged elevation in your blood pressure in your life, then that is a risk factor. And in general, it is good to assess your daily life and see, are there ways that I can make things more ordered, less stressful, and that just sort of helps your overall health and may impact your blood pressure and stroke risk.
That rings true. Makes sense to me. Dr. Benjamin Brown, it's an honor. Thank you for being on our show.
It's my pleasure. Thank you very much.
You're welcome. We'll be right back.
You are ready to buy that house that fits your needs, but how do you find it? Easy. Call Angie at 352-361-8359. Angie gets with you to get that information you need to buy that house.